Hi, everyone. Good evening, and welcome to ACP Live Monday. How has your day been? I hope you've had a lovely day so far, whether you're joining on Instagram or Facebook or YouTube channel. I want to say thank you so much for joining us today. Just going to quickly share the video to all our various platforms. I also encourage you to do the same. So just help us to share and so that other people can know that we're live and they can join us. Welcome. So I'm also just sharing the video. So just give me a couple of minutes to do that. And if today is your first time joining us, ATP Live Monday is a program where you get to ask any questions you may have about the health of your children and get an answer live from a pediatrician. So I want to say thank you so much for joining us today. If you have any question, please start by the age of the child, and then you can ask your question. Try and keep it simple and concise. Otherwise, Facebook will kind of cut off your question. So it's best to always keep it short and concise. All right. So just give me a couple of minutes to pin the videos. We can start. We have just 1 hour for this program, but if you have any questions after the live section, you can always still post your question on our Ask the Pediatrician Facebook group. We are on the group Mondays to Saturdays. I like to emphasize that because a lot of people always come to us in our WhatsApp and say, "Oh, I've been trying to post and I can't post." They do that almost every Sunday, and I guess most people don't remember that we are not available on Sundays, but from Mondays to Saturdays, you can post your questions anytime of the day, and we will try and answer them as soon as we can. So feel free to post your questions. That's where you get the more time to answer. But this live session is just a 1 hour session where we just do it live and also kind of provide opportunity for you to get clarification and also for new people to be aware of our programs. On Thursdays, we do teachings on specific topics, so it's been nice for you to also watch out for that. You can listen on Fresh Waves Radio. You can listen on our podcast, Ask Dr. Gbemisola ATP podcast, and you can also watch on our YouTube channel, ATP TV. That is TV with double E. And then you can also watch on our Facebook group, and they're always there permanently. And if you like to read about any specific issues, you can also go to our website, www.askthepediatricians.com. Most of the topics people ask about, we've written extensively on them. We've discussed them before. So if you want detailed information or learning about those things, those are the platforms where you can learn them. We're also on social media. We're on Twitter, we're on Instagram. So please follow us and learn. And just for you to know that beyond what we do online, we also do community outreaches in schools and indigent communities on our own, and we also partner with other faith-based organizations or other organizations, non-profits as well. So that is what we do on Hacks the Pediatricians Foundation. So welcome everyone. I think I've shared the video, I've shared the link, and thank you for those who are joining me already on Instagram, on Facebook. I want to say thank you so much. So feel free to ask your questions and we'll try and answer them in the next for 55 minutes that we have left on the program. Currently, I cannot see any questions, so that's fine. I guess many people are just joining us. So feel free to start asking your questions now and we'll answer them. I'm just trying to pin the post. Okay, I think I've done the pinning. Okay, okay, I guess I've done all the sharing and I think I've done all the pinning. So it's just to start seeing your questions. And so if you're just coming, welcome. Welcome to ATP Live Monday. I am Gbemisola Boyede. I'm a pediatrician and CEO Ask the Pediatrician Foundation. And it's my pleasure to be here today, Monday, the 3rd of February, 2025, to answer any question that you may have about the health of your children in the next 1 hour that we have. But if you have any questions after the live session, or if you are watching a recording, I also want to say thank you for watching. You can go to our Facebook group and you can post your questions there when we're no longer on the live session. So feel free to always post your questions. We answer like close to 1,000 questions, if not more, every week. And that's a lot of questions. And we also have other Facebook groups. We have the ATP Family Facebook group for the adult questions. We also have the First Time Mom group, and we also have ATP Still a Mom Facebook group as well. So depending on the kind of question that you have, but our most popular is the Ask the Pediatrician Facebook group, which is mostly for parents and caregivers of children to ask any question they may have about the health of their children, and we'll try to answer them and try to guide people to do the right thing. So we are just like a first responder, if you like. And of course, we also work on more on promotion of good health for our children and prevention of health issues. So that's basically what we do on Ask the Pediatricians. So if you have any questions, feel free to ask your questions and then I will be answering them. Thank you so much for joining. I hope you've had a lovely Monday. And remember that you can watch all the past episodes of all this program, ATP Live Monday, ATP our webinars. You can, with all our live sessions are always available on the same channel, whether on Instagram, TV, or Facebook. Our Facebook page, or you can also watch them on our YouTube channel or on our podcast. So there are so many platforms where you can again connect and where you can learn about all these programs and including the past episodes. So I'm just checking whether I have any question on Instagram. I don't think I have any question on Instagram yet, and I don't have any question on Facebook yet as well. So for those of you watching, if you have questions, this is the time to ask, and then we can proceed. And for those on our Facebook group, just to remind you that you cannot just post directly your question on the group. You have to click on the video so that it will take you to the channel, to the page where we can now see your question, because the way it is now, Facebook does not allow streaming into the Facebook groups, so we can only stream to our page. So you ask your question, you have to click on the video. If you put your question directly under the video, I'll be able to see that. But if you put your question in the group, I won't be able to see it from the studio here. But let me just check on my phone in case there's any question in the group. Okay, I don't think there's any anyway. So thank you so much for everyone joining us on Facebook, Instagram. Feel free to settle, feel free to ask questions, and then we will try and answer them. Since today is a very quiet day, we don't seem to have any body asking any question yet. I guess that's okay. That means we are all good. with the health of our children. But if you still have any question, now is the time to ask them. Okay, if you don't have any questions, I always have things to talk about anyway. And I think what I'd like to talk about today, I was actually thinking of doing a proper um, teaching on it on Thursday about the use or misuse of medications, especially antibiotics. I get a lot of questions on our Facebook group, and I see a lot of our parents. We tend to just use medication without prescription, especially the antibiotics. I think antibiotics are the most abused medication in the entire world, and especially in Nigeria. And a lot of us just feel like with things like antibiotics like Ampiclos or Xenax, Augmentin, we can just buy them and we can just use them for our children. Even when children are having cough, no fever, nothing, we just go and buy antibiotics. I just want to discourage us from doing that. Um, for so many reasons. Okay, antibiotics are obviously uh, produced to fight against germs, the bacteria germs in the body of a child. However, those germs are also very clever and very intelligent, and there are reasons behind how we use antibiotics. So when we say, okay, you should use this particular antibiotic for this particular condition, or you should use it for this certain number of days, there are specific reasons for that. So if you don't follow the guidelines, in other words, you use antibiotics when you're not meant to use it, you don't use it for the right duration of time. So some of us, once the child is getting better, we just stop the medication. We don't complete it. That is also misuse. Or some of us, we just use it indiscriminately. We do what I call copy and paste treatment. In other words, once the maybe a particular child has this particular symptom, let's just say cough again, and maybe you went to the hospital for that particular child, and the pediatrician or the doctor just say, okay, use this particular antibiotic. Then when another child is sick, and I see that even in our group, people will just say, "Oh, this is what my doctor asked me to use the last time. So why don't you just go and buy it?" And then I know that people meant well when they do that, but it's a very very dangerous thing to do, because you are not always certain, but what it may not even be the same problem that the other child has, that's, or maybe one of your children had, that the second one is having. So the fact that maybe the last time you went to the hospital and you complain of the same symptoms, they decide to give you this particular antibiotic, does not mean that anytime that particular symptom comes up again, then you just go and buy it. You don't even need the doctors again. And I see a lot of mothers complain about it. So it's like, every time my child goes to the hospital, it's this same medication they give. So why do I even need to bother going to the hospital? Why can't I just go to the chemist shop and buy it? And of course, we have economic crunch in Nigeria. Our pharmacists, some of our pharmacies don't have pharmacists, and even for those who have, they just want to sell drugs. So ideally, if not, there's no reason why a mother should be able, or anyone for that matter, should be able to walk into any pharmacy and buy an antibiotic without a prescription. It's never done anywhere else in the world. And I, even though I am a pediatrician myself, I cannot just walk into any shop, a pharmacy, and I'm a doctor and I'm a specialist, but I cannot even just walk into any pharmacy and buy antibiotic over the counter, even for my own child as a pediatrician, because that is not right. I need to get a prescription, and even I won't be allowed to write for my own child. I will have to get one of my colleagues to write for my own child. So that is how things are. But in Nigeria, anybody can just walk into any pharmacy and just buy antibiotics, and that ought not to be so. So these are the things that is fueling what we call antibiotic resistance. Because what happens is that when we use antibiotics indiscriminately, when we use it when we should not use it, when we use it for the wrong condition, when we use it uh when we use the wrong antibiotic for a particular condition, even though the condition needs antibiotics, and when we don't use the antibiotic for the long enough duration, maybe it's meant to be used for 3 days, you use it for 1 day and you stop, or you use it for 5 days when it's meant to be used for 7 days. These are things that will make those germs to develop what we call antibiotic resistance. And what that means is that next time that particular germ affects your baby and we give the child that antibiotic, which ideally should have worked, it may not work anymore because the germ has developed resistance to that particular medication from our indiscriminate use. And this is happening a lot because a lot of our mothers, we've abused ampiclox, amoxil, even people I see mothers using things like Xanax, Augmentin. These are very strong antibiotics that will not be the first thing I will even prescribe for a child, but people just say, oh, it is just go and buy even third generation cephalosporins. People are just using it because everybody just wants to sell drugs, and it is very dangerous. The challenge we're not having is we don't have so many new antibiotics, okay? And we have so many of them. They are finite. It's not as if we have unlimited resources of antibiotics. And in the last few years, we have not actually developed new ones. So we see the old ones that we have to use, the same ampiclox, amoxicillin. So if a child develop antibiotic resistance, it means if we give that child that particular antibiotic, it won't work. And what that means is now that we have to start looking for antibiotics that the child will be able to take and that will work. And that may be difficult. And if for any reason, especially for mothers that are really, really abused all sorts of antibiotics and we can't find any antibiotic that will now work, then that is a death sentence for that child. So we really need to think about it, not just a short-term thing, not like, oh, this doctor is because we want you to come to the hospital, we want you to come and pay consultation fee. Now, I'm telling you this, you're not paying me any consultation fee, so it's not about the money. It's about our children well-being, and it's about our children. Because, and I've been in this situation before, and the child will be in the hospital, we will be using all sorts of antibiotics and they are not working, and then we have to go to the antibiotics that we don't even use often. And those ones, of course, the rarer you use an antibiotic, the more expensive it is. Number one, they are so expensive, sometimes they are so difficult to get, and then sometimes we may even not still be able to work with that. So indiscriminate use of antibiotics is a dangerous thing. And so please, mothers, fathers, parents, I plead with you that you don't use antibiotics indiscriminately, because you are setting up your child for antibiotic resistance, for very serious illness that, God forbid, the doctors may not be able to solve because we don't have the antibiotics that will work for that child, because the child has been using antibiotics indiscriminately. So please, let's stop. So most of these what are the common misuse of antibiotics? So a child who has cough and catarrh, most of the time they are due to viral infections. And because they are due to viral infections, if you viruses don't tend to require medication, because we know that they are going to run their course and they are going to go. So those children, please do not give them antibiotics. I see a lot of mothers say, oh, and I've given her ampiclox, I've given her this, no, and the cough has not gone. You are not meant to give that child ampiclox or amoxicillin or antibiotics. If a child is having cough, catarrh, no fever, no fast breathing, no difficulty with breathing, it is most likely a viral infection. It will run its course most 1 to 2 weeks. It will go giving antibiotics does not make it better. Rather, it actually just sets up the child for antibiotic resistance. So please do not give antibiotics when we just have cough and catarrh. Then some of us we think that we have to treat every child for malaria, even though malaria is not strictly speaking antibiotic, but it's antiparasitic. It's still in the same kind of family of drugs we use to treat certain infections. In this case, it's malaria infection. I know it's our fault, because when we're trying so hard to eradicate malaria, we just tell you, just we give you the power to treat yourself and to treat children for malaria. But so because of that, now I know parents who ask me questions like, can I just treat my child for malaria every 3 months? And I know people that do that every 3 months. They just give their child anti-malaria medication. Please stop. Please stop. And I know people that once the child has fever. In fact, in Nigeria, it's so bad. We think fever is just means malaria. And so people will ask me questions like, oh, my child has fever and I've treated her for malaria, but fever has not gone. As if, why should the child still be having fever when I've treated the child for malaria? And I'm like, why not? Malaria is not the only thing that can make a child to have fever. There are like 1,001 reasons why a child can have fever. Malaria is just one. I know it's the most common in Nigeria, but it's not the only one. A child can have malaria, can have fever from virtually infection of any organ. Maybe he's having high infection, ear infection, something in the nose, something in the throat, something in the urine, something in the blood. So there's so many causes of fever. So just giving children anti-malaria indiscriminately, we should also stop it. And that is why we've gotten to the point where our chloroquine and fancy that they don't work anymore, because we have abused them. Now we are down to ACT, that is the artesunate combination therapy that we're doing now. And some of us already are abusing it to the point that children are beginning to develop resistance to those anti-malaria, and we don't have another one. So after the ACT, we don't have another anti-malaria. So we may have to go back to our chloroquine. So please, let's not just treat children. Nowadays, we have developed technology that we can test malaria. Before we need, before you can treat malaria, they have to take blood. They have to be a microbiologist or somebody who is trained, have to look in microscope to pick up. Now we have what we call the rapid diagnostic test. So we have tests that we can do for malaria, and within a few 30 minutes or less, we will get the results. So we will know whether that child has malaria or not. So on that basis, we should not be giving children anti-malaria without tests. So if you think your child has fever, please don't treat them for malaria. Take them to the hospital, and then they can treat them for malaria, and they will do the test. And if you are the type, before Adija Kubura, I see your question, I will answer it now, but let me just quickly finish this thought. And if you are the type that go to some hospitals in Nigeria, those hospitals, I call them malaria typhoid diagnostic center, if you like. That's the only diagnosis they make. Everybody has malaria and typhoid, and everybody has to be given antibiotics and anti-malaria at the same time. Please stop using the hospital. I was answering a question yesterday night in the adult section. A woman was saying, oh, I've been to the hospital because they tested me, I have malaria. They gave me malaria drugs. And then I went back and they tested malaria is still there. And they gave me injection. Then I went back and they tested malaria. And I'm like, why are you going back to be tested for malaria all the time? Number one, we don't treat lab results. We treat the person. So if you've taken anti-malaria, are you okay? Are you better? If you are better, you don't have fever anymore and all that, you don't need to go back to be tested again. Okay, you don't. We are not planning to eradicate the malaria parasite in your blood. And two, there are a lot of labs these days that they don't do nothing. They just look at, they just put 2 pluses, 3 pluses. And I said that with all sense of responsibility. We know there are people that don't do no test and they will write something for you. And that is the danger with some of us. Any little thing, we will go to the lab. We will not go to the hospital. You just say, like, test me. And then they test you. Oh, you will always have the malaria. Never. They will never say you don't have malaria. And then the next thing, you just go to the chemist and buy drugs. And then, I'm not better. Then you come back to us. you have not followed the right. You should have started with the doctor first before you go to the lab, before you go to the pharmacy. Again, it's all because our system is broken down. Number one, the lab person should not even do a test for you when a doctor has not requested it. But everybody wants to make money. Man must work, okay? The pharmacy should not sell you drugs when a doctor has not asked you to be sold drugs. Again, everybody must make money. But it is not helping our health situation. So please don't just go treating yourself for malaria, especially the children. I'm actually here for the children. Don't just go treating yourself for malaria. If you think your child has malaria, go to the hospital. And it is very, 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 very rare for a child to have both the malaria and infection at the same time. Appa, God is not wicked now. Why is it the same child that will be having malaria and having infection at the same time? So all this one, we are treating malaria and infection antibiotics at the same time. We are actually just abusing medication. So we should be convinced in our mind. And I also speak to my colleagues. We should be convinced, is this child having malaria or is this child having infection? And if the child has infection, where is the infection coming from? Is it in the urine? Is it in the chest? Is it in the throat? That is where we have to examine the child. And we're not treating the full blood count. We're not treating the blood test. We're treating the child, And sometimes we treat based on our clinical suspicion, not always on the lab. We don't treat the lab result, we treat the child, but we use the lab to confirm what we already suspected clinically. So let's just stop drug misuse. Let me just answer questions that have come up while I was talking. So Adija is saying, what other things can cause excessive salivating for a boy of 3 years? That was the one a year ago. The salivate is up to a month. Now it's on the spectrum. When you say spectrum, I hope you meant autism spectrum disorder. Was that diagnosed by a pediatrician? I hope it's not an assumption. Okay. All right. So let's start by stating that worm is not even the cause of salivation in most children. Again, people tend to ask a lot of questions that we make a lot of assumptions. We make so many assumptions, and it is dangerous to do that. And I've said that to the moms with all sense of responsibility. I know we're the first doctor in the house, and we wear our doctor's hats a lot. But I see a lot of even our group people come and tell me, "Oh, this child has this rash. I think it's this. So what should I give? Because what should you use to treat that particular thing?" And I'm like, how did you even know it is that? Because it is not, and I don't even agree with you, but you're asking me for the treatment. You're not even asking for the opinion, whether we agree with you or nothing. You're just going straight to ask for treatment, which is wrong. So don't make assumptions at all. It's better to ask, okay, rather than make assumptions. A child having worm infestation does not make them to actually salivate. So that is something old wives' fables that people have said over the years. So they think when somebody is having nausea or having is worm, it is not any worms. Worms don't do that. Worms make children to lose blood. Worms make children sometimes have abdominal pain, or they pass out the worms, or they lose weight, they are malnourished. They don't actually salivate. The worm is actually eating all the food in their tummy, so it's not the salivation. So there are many reasons why children can be drooling saliva. Starting from things that are normal. For example, a child who is bringing out new teeth and all that can have some drooling of saliva. Sometimes some children drool because they have what we call weakened facial muscles. So especially for our children with special needs, they tend to salivate a lot because some of them have some the muscles are not doing their work they're supposed to do. For example, children with cerebral palsy, because they have these neurological issues. So sometimes they are not able to swallow their saliva. They have weakened swallow and all that. So they make the reason why you and I are not drooling saliva is because as you are making your saliva, you are swallowing it. So we all swallow the saliva we make, and that's why your saliva is not coming out. But for children, for one reason or the other, have a medical, like a neurological problem, sometimes they are not able to swallow their saliva. And so that is why they drool. That's why sometimes you see that they always keep their mouth open and all that. So they don't have that capacity. And sometimes for some of those children, what we do is to dry up the saliva for them by giving them medication to reduce the amount of production. So if your child is on the spectrum, your child is a special needs child, I'm not quite sure, because I always like to be sure that that diagnosis was made correctly, because sometimes people use a lot of terminologies that are not necessarily correct. And there are a lot of special needs children, and everybody is not on the spectrum. Some children have global developmental impairment, some children have cerebral palsy, some children have autism. Sometimes they can have all of them together. So unless, if a pediatrician has made a diagnosis, that is fine. But I just don't like when parents use it without it being made by a doctor, because sometimes we may use it wrongly. So children who also have things like Down syndrome and some of these, our special needs children, some of them have that neurological issues where they struggle to swallow the saliva, so they drew a lot of saliva. Also, sometimes when there's infection around the throat, because when there's infection around the throat area, children also, maybe they have sore throat, they may not be able to swallow properly again. They may draw saliva. So those are the common things. Sometimes there are other reasons. Some children produce too much saliva itself for some other reasons. But the most common reason is that it's either the child cannot swallow because there is weakness or their ability to swallow is reduced, or the child has something blocking the airway and it's making it difficult for them to also swallow because of pain and all that. Those are the most common reasons. The child is bringing out a new tooth, and also sometimes they salivate a lot. But otherwise, a worm does not make children salivate. So deworming them is not going to solve any problem. So I would recommend that if your child is not to a pediatrician, you can have them have a look, and they can advise. Most of the time, we just wipe it off, we clean it off, we don't make a big deal of it. But if it is really that excessive to the point that some children, they are wetting their bibs so much, and the bibs have to be changed several times a day, then for those children, then we will give them some drugs that dry up too much saliva. Sometimes we actually go to do an operation and remove some of the salivary gland, or tie up some of the places the saliva is coming from. I won't bother you with all those jargons. I hope that's helpful, Kubrat. All right, I have a question on Instagram by Timeless Signature. And Timeless Signature is asking, what is my recommendation on deworming children? All right, thank you so much for that question. So if you leave, so deworming children is location dependent. Okay, I was actually looking for the right terminology because I don't want to confuse you. Because this program is watched live everywhere in the world. So I have people from US, South Africa, UK, and all that watching. So I always know how to choose my words carefully. So there are countries where they don't deworm their children routinely because worm infestation is not a problem for them. So they have clean environment, clean water, clean food. The children don't go play in the farm and getting worms and all that. So if you live in those areas, we don't routinely deworm children. We only treat them when they have worms as infestation. But if you live in a place like Nigeria, where we have what we call endemic situation, where we have lots of our children having worms infestation, WHO recommends that in such places the children are dewormed every 6 months. They don't need to have the symptoms. We deworm them every 6 months. So that's why you see some people say, I live in the UK, I've never dewormed my child, because that is not routine for them. But in Nigeria, we deworm our children because we live in an environment that is endemic for worm infestation. So you deworm your child every 6 months. You don't need a prescription from a pediatrician. You can go buy a warm expeller in the pharmacy. This is one of the things you can buy from the pharmacy without a prescription. You can buy, there are many of them, Combantrin, parental palmates. You can buy Habendazole, all the different brands, and the dose is always very easy. It's written on it, but if it is not written on it, some of them will say, ask the doctor. We usually recommend Albendazole as the most common one, but you can use it only from the age of 2 years and above, or sometimes 1 year. You can give 200 milligrams to a child who is 1 year to 2. From above 2 years, it's the same dose for adults, for children. From 2 years old, Albendazole is 400 milligrams. So if it is a liquid, it's the old liquid. Some of them come as 400 milligrams in 20 mils. Some of them come as 40 milligrams in 10 mils. But if it is 400 milligrams, as long as that child is 2 years old, to your own, even you as the mother, it's the same dose. It's that 400 milligrams we all would take. And it's one dose. You just take it once and that's it. So you can give children the liquid, adults can take the tablet. Older children can swallow the tablet as well. For children that don't like to swallow tablet, you can put it in like the swallow about semo or whatever and let them drink it. You can take it with food. You can take it in the morning. You can take it in the afternoon. There's no magic. People say, you have to take your warm expeller in the morning. No, there's no magic. You can take it any time of the day, and you can take it any with food or without food, doesn't really matter. But you can repeat every 6 months. But if your child passes out worms, that means the child already have worms and infestation. Then that child needs to be treated. Usually the treatment is about 3 days, and then we'll repeat it in 2 weeks. That is different from a child who doesn't have worms that we are all just deworming. Somebody is asking, where can I get the malaria test? All the hospitals should be able to do malaria test. Any hospital that is standard should be able to do malaria test for your child. So please be aware of where they treat your child for malaria without doing the test, okay? And the test is something they can do, just a drop of blood from the child, put it in, it's an automatic test. So they should be able to tell you. If we think we want to do something more extensive, then we take proper bloods. But most children can be tested using the rapid test for malaria. Even when we go out to do our outreaches, we do malaria tests for people. When we do our community outreaches, we test people on the field for malaria, and we only treat them if they have malaria. We don't just put them on anti-malaria without test. So if we can do that, as a community outreach, not even an hospital, in the community. So most hospitals should be able to do the malaria rapid test. All right, let's go on. Tolulope say, why does a 1 year 3 months old child doesn't swallow food? Why? I don't know why. That is just your child. So there's something that I just peculiar to that child. So it is not like it must have a reason. You understand? So the child just not to want to take solid food and all that. So, but that is really not appropriate for a child to be on formula at 1 year old. Then if I have more time, I would have loved to ask your journey into complementary feeding. How did you start complementary feeding? What were you giving the child? How come this child is still on formula as 1 year old? By the time a child is 1 year, we want the child to be on the same family diet. Everybody is eating. So, but I don't have that luxury of time now. But some children can be fussy with food sometimes because we have actually not done the journey well. Normally, I'll recommend first that you go to our group and watch all the videos on complementary feeding. This is how it should be done. Make sure you yourself you're doing the right thing. So if you're doing the right thing and all that, then you may want to see a dietitian. Sometimes we need to be sure there's nothing wrong with the child, throats and all those kind of things. So we usually use our speech therapists to do what we call assessment for swallowing and all that. But most of the time, it's none of those ones. It is usually just a child with fussy and who does not like, and maybe because we also didn't introduce a child on time. This is a challenge when you do a lot of bottle feeding and everything is coming in the bottle and everything is formula, everything is liquid. And you don't, so we want children to start taking from the cup and the spoon from 6 months. We want you to start letting them take, even when you start with the porridge, it has to be thick, and then you gradually increase. By the time they're about 8 to 9 months, you have increase the texture to like mash, not just puree. And then by the time they're about 1 year, they should be on full solid. But it's not too late. It's just that we have to, go through the whole process again. So I'll recommend you see a dietitian to walk you through it. Or go through our videos. Sometimes you may just be able to pick up what you need from there, and you can take it off. I don't know, but it's a whole consultation and all that. Okay, Tara say you're asking for the test kit. They sell it in the market. So if you go for malaria test kits, they sell it in the market. It's available. If you know where to buy, if you are in that field, you will know where to get it. So it is not something, if you're not in that field, then it's not something you should be dealing with at all. But those who are in the field knows where to get it. All right. Oluchi say, when does gas resolve in baby? What do you mean gas? Okay, because everybody see have gas in them and everybody see pass out gas. So I'm not quite sure I understand that question. You mean your child is dealing with gas? You mean your child is having colic or what? Once breast milk enters the tummy, it start hurting her, she stop feeding. All right. So number one, we need to sort of break your questions because you've made a lot of assumptions again. Breast milk in the child's tummy does not hurt the child's tummy. Okay, now if your child is feeding and start feeling as if the child is uncomfortable and the child stop feeding, the first thing you want to know is why. Don't just make assumption it's gas. So gas is the child trying to bring out gas. That is a child who has actually finished eating, not the child who is just starting to suck, because that's the impression I'm getting from your question. The child started to suck and then the child is stopping and then the child is uncomfortable. So there's something that doesn't sound like a child who is having gas issue. Okay, that sounds like is it that the child sucks and it's not getting breast milk out, which is the child telling you, I'm sucking on your breast, but nothing is coming out. So you want to make sure that if the most important thing when it comes to breastfeeding is 98% latching of that baby to the breast. The baby has to suck on the areola, and breastfeeding is not always straightforward for most new moms. We have to teach you how to breastfeed your babies. Some people just think, oh, I should just know how to breastfeed. No, sometimes we need to teach you. And ideally, with this baby friendly initiative, we actually should sit with you, make sure you know how to position your baby, make sure you know how to put the breast in the mouth. The whole of the breast has the nipple and the areola has to be in the mouth of the baby. So when the baby is sucking, then the baby will take in a mouthful of breast milk. Baby will swallow it and then that will go on. Number two, be sensitive to your baby's cues. Don't wait until your baby has cried and cried before you start putting them to the breast. So sometimes the child is already very upset, and when they cry, they suck in a lot of hair, and that could make them uncomfortable as well. So usually we should not wait till children are crying before we put them to the breast. So once they start opening their mouth, yawning, and they start, seeking out the breast, that is when to put them. So you must be sensitive to the cubes of your baby, or at least then make sure you breastfeed them maybe every 3 hours or every 2 hours, depending on the age of your baby and how frequently your baby wants to suck. So children tend to, if a child is sucking and they are rushing and they are it's sometimes in that process they're taking a lot of hair. That is what can make them to feel gaseous. And what you need to do, that doesn't affect them when they are sucking. That tends to affect them after they finish sucking. And what you normally do, we recommend that you put your baby on your back and pat their back and allow the gas, to allow them to burp. So the gas will come either through the mouth or through the anus, and then after 15-30 minutes you can put them to sleep, put them down flat, but not before. But all those things does not make a baby not wanting to suck. So your baby starts to suck and start acting uncomfortable, it is very unlikely to be a gas issue. It is most likely a breastfeeding issue. So what we need to do first is to make sure that baby is actually well positioned, the baby is sucking, and the breast milk is coming out. Okay, because if the milk is coming out and that baby is able to swallow the milk, then there will be no problem. Okay, and if the child is not vomiting or choking on the breast, because there are also medical conditions that can make a child to be uncomfortable, they start choking on the breast and all that. So we need to check for all that as well. So it's very, very important that you make sure that all the right things are in place. Yeah. So if you say you hear her tummy make rumbling sound, so why would the child's tummy be making rumbling sound? How did the hair get into the child's tummy in the first place? So that boils down to my question. So it's either that you've allowed that child to cry a lot, or the child has sucked on an empty bottle, because the gas has to enter the child's tummy. Okay. So if the child is already have that episode, and then you are now trying to breastfeed the child as a way of comforting the child who is already gaseous, then that's not going to work. Okay. So what you need to do is to, pat the child on the back, let the gas be expelled first. Okay. But if a child is been sleeping, hungry, and then wake up to feed, that child should not have gas in their tummy. The only reason why that child will have a lot of gas, and unless you're also doing mixed feeding, because those who do mixed feeding, you are using bottle, and most of the time the bottle also have a lot of gas in them, and your child has taken that in. If that is the case, then that's another answer. But basically, the point is that you need to figure out why is your child having loads of gas in their tummy, and try and deal with that. So I've given you instances: a child who cries too much before you feed them, a child who is sucking on the bottle, some of you give children pacifiers and dummies, they're also sucking a lot of gas weight. Those are the things that, so you want to go for deal with all that, get rid of it. And then when you want to breastfeed, make sure your child is well attached to the breast, so that it's the milk going into the mouth and nothing else, in the mouth of the baby. So I hope that's helpful. But if you still struggle with that, you can see one of our a pediatrician but your child should not be having gas and gas all the time. All right. So I have a question on Instagram about the Loretta Mall. Where did you see the question? You say, I saw a post last week about a mother-in-law that gave a baby whiz on exclusive breastfeeding water and the baby died. How true is that? I can't answer that question because obviously I'm not the one. I'm not there. Is it in our group that you saw the post, or is it somewhere on social media that you saw the post? So you need to tell me more. I can't say whether something is true if I was in that scenario. I don't know who posted. I can't answer that question. So, but if your question is it possible for a baby to die when given water? The answer is the water is not what killed the child. Okay, if that's your question, that is it that the child, unless the child aspirated the water or the child choked on the water, but the water itself is not what will kill the child. So you need to rephrase your question. I really need to understand, is it that you saw this in our group, or you saw it in another Facebook social media? Is it somebody else saying that? And you see, when people ask these questions a lot on our group, people come and ask me, blah 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 blah, the child died. Why did the child die? What is the cause of that? I can't always answer that question. Even if I was the one that treated the child, sometimes we can't always answer that question. Okay. And please be careful how you extrapolate things. Okay, I'm happy it's not in our group from a doctor handle. Okay, good. I can't talk about that. I guess that doctor will know how to, but let me just speak generally to that question. Even when we treat children in the hospital, we always don't know the cause of that. That is why we do autopsy. Okay, so be very, very careful of extrapolation before people build doctrine on the fact that, okay, if you give a baby who is exclusive breastfed water, the baby is going to die. It is not true. That's not going to happen. The baby who is on exclusive breastfeed, if you give them water, they are not likely going to die from the water unless they have diarrhea or the water is contaminated or there's poison in the water. What will happen is that the child is going to be malnourished, they're not going to gain weight, they will have diarrhea, they get sick from lack of exclusive breastfeeding. But the fact that you give them water is not going to kill the child. So don't make assumptions. And a lot of people come to the group as well and post those kind of questions. I did this, I did that, and my baby died. And they most times people who ask those questions are feeling guilty and they want to blame themselves or they want to blame somebody else. Like this case now, I think they want to blame the mother-in-law, that she did something and killed the baby. That is not how doctors extrapolate the cause of death. If a child died unexpectedly, When somebody died unsuspected, and this is general medical practice now, we need to do an autopsy. You may be surprised the child may die from something completely unrelated to breast milk and water. The child may have died from maybe undiagnosed heart condition or a bleeding in the brain, and all. That's why we do autopsy. So don't. So when people ask me those questions and I say, "Oh, I don't know," it's not because I'm ignorant, but because you cannot always say the cause of death. Number one, I wasn't even part of that child's life and all that. But let's even say I was part of that child's life. Sometimes, even if I'm part of that child's treatment and I know everything about that child, and I was not expecting the child to die, and the child died, then I'm going to need an autopsy to know the cause of that. When we write death certificates, we always so if somebody died within 24 hours coming to the hospital, we will not write the cause of death because we don't know. We will always go for an autopsy first. So please, social media people, be very careful of extrapolation. A mother, do you know how many mothers breastfeed their baby and give them water? How come all of them are not dying? So if this baby died, there must be more to it than just the breast milk and water. On the only other reason I can think of is baby choke on the water or baby choke on the breast milk, if the child aspirated. But the breast milk, the water, mother-in-law, those ones alone doesn't cause anybody any death. So we should be careful. And I can't always answer those kind of questions, whether it's true. I wasn't there. How can I know whether it's true or not? And on social media, people can spin a lot of stories. So I always don't take it. But if it is a doctor that treated that child, the child was in the hospital, and that doctor is the one that we know the true situation. And even then, I would still expect them to do an autopsy first before they will begin to come and say this is the cause of death of that child. So we don't do that. All right. Okay, my time is running. Okay, let me go back to Facebook. Who got you saying, how else can I handle constipation in a 6-year-old? It has been happening since. Eat fruits and vegetables. She's the only one constipated. Okay, you've been to the doctor. Good. She recommended a drug, insertion. Okay, suppository, liquid paraffin. Good. And when is, yeah. So you've done the right thing. You've been to the doctors. The doctors have treated your child. So I don't think there's anything else I'm going to recommend more than if your doctor has treated your child. The doctor, I believe, would have asked you questions to know why your child is always constipated, and you know the usual saying: drink a lot of water, eat a lot of veggies, and ensure the child has a good bowel habits and all that. Some children, for some other reason, medical reasons, may have chronic constipation, and they have to be on the laxatives or stool softeners for a very, very long time. So, for example, children who have H-prong disease and things like that, there are conditions that can make children to have chronic constipation. So, I would expect that your doctor will refer you for the evaluation of those kind of condition if you have done all the basics. So, the most important thing is ensure the child has good bowel hygiene. So you may want to make sure the child goes to toilet, whether they feel it or not, first in the morning, last thing at night, and then you make sure that they drink a lot of water. Sometimes children say they drink, but they don't. You have to monitor some of these things because you are not there when they are in school. So you may have to supervise and devise other methods of making sure they're actually doing the right thing. But otherwise, you can see your doctor. I actually don't recommend liquid paraffin. It's so messy. There are other more much better laxatives. So your lactulose, Movicol, Laxidol, those are much better kind of laxative we use in this age now. So, and they are over the counter, I think, most of them, but some of them you need a prescription from your doctor. All right, but discuss with your doctor and the pharmacy. But also, child has constipation, we have to clear the bowel, and then we can now start working towards not prevention. But if there's a medical reason, then your doctor will refer you to the appropriate specialist. Okay, so Lokwe said I did complain food for her. She was taking solid at the time. Okay, good. When she was 9 months, but she just reduced drastically at the time. Why? Though she was just born, she was diagnosed with suspected laryngomalacia. Laryngomalacia has nothing to do with feeding. No, it has to do with breathing. So the question is, what happened? Why did the child suddenly stop taking the solid? Why did the child reduce drastically? Those are the kind of question I need to ask. Something happened, so we have to go back to where the child stopped, and then try and get the child back on track again. All right. Okay. All right. Okay. I don't have any question on Instagram. Esosa Celestina Shasha says, please, is there any special thing you do for a newborn baby for the leg to turn normal straight leg? Normal straight. No, I'm not quite sure I understand the question, but we don't do any special thing. And please don't do anything to the baby's leg. Leave the baby's leg alone. Baby's legs are not going to be straight when they are born. Baby's legs, baby, when they're in the womb, they are flexed. They are they are bent like that. So, and then when they are born, they still try to assume that position again. Then your baby should have been examined by a pediatrician. Every baby must be examined by a doctor. I mean, not necessarily a pediatrician, but at least a doctor should examine the baby. And if they think there's anything unusual with the baby's legs, they would have told you, and they would have told you what to do. But please don't massage any leg. Just leave the baby's leg alone. Okay, the baby's leg is, I'm not sure what you mean by straight leg. I don't know what you mean by straight leg, because normal baby is not walking. So how do you know the leg is straight or not straight? Maybe when they lie down, they don't keep their leg straight. They always keep their leg folded or flexed. In fact, I'll be very worried if your baby's leg is straight when they're lying down as a newborn baby. I'm not really sure what you're trying to describe to me, but I also want to be sure you are not misunderstanding what is normal for abnormal. I don't know whether that makes sense to you. Okay. I want you to make sure a doctor sees your baby first, and let them be the one to tell you whether there's anything wrong with the leg or not. Don't go massaging this baby's leg. Don't go cause any babies any problem. Babies don't keep their legs straight when they are born, and that is not anything wrong. If it's the feet of the baby, sometimes the baby's feet may be a bit coarse, or maybe I will got club feet and all that. But then I expect a doctor who examine your child would have told you that. So it's a little bit tricky. Sometimes I know parents are trying to tell me something and you're trying to make a lot of description, but maybe you're not just using the right terminology for me to get what you're trying to say. So what I recommend, one, you can either do a video and post on our Facebook group. At least I can see the leg myself, or you can get one of our colleagues to have a look at it. So those are the two options I'll give you. Do a video of that leg of the baby. Just put the baby normally. The baby will normally be, and do a like 30-second, 1-minute video, and let's just see. And then I'll let you know whether that's normal or not. Or if you don't want to post your child on social media, which is also perfectly fine, please see a pediatrician about what you are concerned about this baby's leg. But please, let nobody massage any leg. Let nobody go and break your child's bone. Please. And I know what I'm saying, because a lot of people do all that kind of, and they cause more trouble than while we're looking for what is not lost. So please, just let the baby be. At least for now, do nothing until you hear from me or one of my colleagues. Okay, so if you've been to the UK doctors and they said the baby is fine, then the baby is fine. If the doctors have said baby is fine, baby is fine. I don't know what you're worried about. But you can see if you're in the UK, see the dietitians. I think you can self-refer yourself or get your visitor to refer you to the dietitians. They will walk you through the solid part of things. So I think just see the dietitian. You don't need to see the GP, just your dietitian. Either if it's a place where you can self-refer, or if it's a place where your editor has to refer you. Oh, okay, it's the feet of the baby. Because when you say legs, I was like, what could be wrong with the leg? Okay, feet, yes, we know that sometimes the feet can be some babies can have what we call intoning of the feet, club feet, whatever. So what I really need to do first is to get a pediatrician, a doctor, or post it on our Facebook. Let's see the feet. Then I would tell you what to do. Because if they say like club feet, some of them, there are some things we do like serial casting. We put POP, we try to straighten it a bit and all that. Yes, we can do that, but we need to see it. So some of them, it's not like anything serious. So we just leave it alone because we know correct by itself. So yeah, if it is the feet, we can talk about that. I was worrying about the legs. Okay. Guys, this is my last person, Kemi Simon, I guess. Good day, ma'am. My 12-year-old son has been snoring since he was 3 to 4 years. So what have you done about it? Maybe it's 8 years ago. So what have you done since the age of 3 to 4 years? So I want to believe you must have done something. All right. So you should let us know what you've done about it. Or if you have not done anything, then you should see the ENT doctors so that they will have a quick look in the throats and all that. Some children snore as habits, some children snore as a result of obstruction in the airway, and those are the ones. But then if your child has been doing since 3 to 4 and it's now 12 years old, that sounds like, so my question is, why are we asking now? Why have we not done anything about it? So, or is it getting worse? Is it getting better? Those are the kind of question we like to ask. But short answer, see the ENT doctors, so they will be able to examine the child and know why the child is snoring. Some adult snores as well, really. I think sometimes it's just an habit. Does it change? Does the snoring stop when they change position? So if it is like maybe when they're lying on this side, if you change the position, if it gets better, then most likely it's just a positional thing, an habit thing. But if the child is especially snoring a lot, even when they are awake, they are mouth breathing, then yes, I will worry about that. And that's the one that we will want you to see a pediatrician for, ENT doctors for. All right, my time is up. Thank you so much. Initially, I started slow, but eventually many people joined me. Thank you so much. So, but just to remind you what I said at the beginning of the program, please, 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 mothers, can we stop the use of drugs indiscriminately? I actually want to speak to that topic. I wasn't sure whether I should get a pharmacist, but whether I need to do it myself. But really, can we stop? No antibiotics without prescription. No anti-malaria when the child has not been to the hospital for malaria tests. I think the only thing we allow you to give is paracetamol and give deworming tablets. Yeah, otherwise, please don't give your children drugs. You can give them multivitamin if you want to. It's not necessary. Let them eat fruits and veggies. But those are the things we recommend. Otherwise, let's just be very, very, very careful how we load our children with drugs. Honestly, drugs are poisons. The less drugs, the better for the child. And I know economy is not so good. I understand. And I know you all want to boycott the doctors because we tend to charge you a lot of money. I understand. I actually wish you don't have to do that. I wish we have a system where we can see your children without you paying, and we can. Most of the government hospitals, general hospitals, I think we see children without them paying, or if I thought they're going to pay, maybe very late. So at least minimum, come and let us tell you what is wrong first before you don't go to the lab first, don't go to pharmacy first. Sometimes you actually spend more money that way than if you have actually come to the doctors. Yes, so please, I know the economy is biting, but go to the hospital. Yes, I know you have to wait a long queue, but it's the health of our children. We have no choice. That's why we do ATP, so that your children will be well, so that you don't have to go to the hospital. That's why we teach you all the time. We promote exclusive breastfeeding. We talk to you about immunization. So we teach you all the things you can do so that the children will not be sick. But please, once they are sick, at least for the children, please take them to the hospital. Don't just go to the lab or just go and buy drugs. Sometimes we are doing more harm than good for our children, and it worries me, and I think we can do better. So that's my word of admonition for the day. Let's not just use antibiotics indiscriminately. Let's see our doctors. If you don't have money, go to general hospital. Don't go to the health centers. I'm really, really worried about the health centers right now. Go to a center for immunization and all that when your children, yeah, but don't go there when your children are sick. Most of those people there are not doctors, and they are, unfortunately, in Nigeria we're having a system where people don't know everybody don't abide by their calling. it's really so sad the way the system is so messed up, because people go to health centers. Health centers are supposed to decide, like, if it's something they cannot handle, then you go to general hospital. But I notice that most of them don't want to do that. They just want to treat the child. They start recommending, go and take this injection, go and do this, go and do that. I don't know why. Really, they are not meant to be doing that, because I know what they are meant to do, because we empower them to do certain things on our behalf, and we tell them, okay, you can treat this one, you can treat that one, then anything above that, but most people don't follow that, because I don't know whether they want to make money for themselves. I don't know really. But so because of that, right now I have no confidence in some of the health centers in Nigeria. And I say that with all sense of responsibility, because for me, the children's health is priority, not trying to make anybody feel good. So if your child is sick, go minimum to a general hospital or a standard private hospital that has a doctor or a pediatrician. Those are the places you should take your sick children. If your child is well, go for immunization, go for vitamin A, go for weighing and other. Yes, go to a center. But if a child is already ill, please go to a place where you will see a real doctor, not people who are not trained and will be treating you like their doctors, telling you to do tests, telling you to take drugs. They are not meant to be doing that. They don't have that capacity, unless some health centers, comprehensive ones that have a doctor. But if they don't have a doctor, please don't let them treat your child. Yeah, so I'll talk more about it on Thursday. So if you want to hear more about uh indiscriminate use of drugs and how dangerous it is and what we can do about it, so join me on ATP webinar on Thursday. I really like to talk more about it. So many things I like to talk about. Well, I'll keep doing our best, even if it's only one person that got this message and save that child. For me, I'm not really bothered about the numbers. Honestly, saving one child is 100%, because for that mother, it is 100%. It may not be a lot in Nigerian statistics or in the world WHO statistics, but for that particular family, it is 100% for them. It is their own child. Nobody wants to lose their child. So I don't mind whoever gets that message, so and they're able to do the right thing and they're able to save their own child. That's, for me, is enough, because one child is worth it. So thank you so much. I'll see you again on Thursday, ATP webinar. I think we'll do it again 6 p.m. But you can also listen on Fresh Waves Radio at 10 a.m. Thank you so much. Have a wonderful evening. And if you have any questions still, please go to Ask the Pediatrician's Facebook group. Or if you are just joining, you are just coming in, welcome. But please, you cannot post your question again anymore on the live session. But feel free to post in our Facebook group. We will answer them. Till next week, again on ATP Live Monday. Have a wonderful evening. But don't forget to join us on Thursday for our webinar session. Bye. Bye-bye.